Should I be concerned about bleeding 10 days after a period?
Hey there! Welcome to today's video where we'll be discussing an important question. Should I be concerned about bleeding 10 days after a period? It's essential to pay attention to any changes in our menstrual cycle, so let's dive right in and explore this topic together.
Understanding the menstrual cycle.
Before we address the concern, let's briefly understand the menstrual cycle. The menstrual cycle is a complex process that occurs in the female body, involving hormonal fluctuations and the shedding of the uterine lining. On average, a menstrual cycle lasts about 28 days, but it can vary from person to person. It's important to note that the menstrual cycle is not an exact science, and there can be variations from month to month.
Normal variation in bleeding.
Bleeding patterns can vary from person to person, and what may be considered normal for one individual might be different for another. In general, a normal menstrual cycle lasts between 2 to 7 days, with bleeding occurring during the first few days. However, it's not uncommon to experience spotting or light bleeding outside of the usual menstrual period.
Causes of bleeding 10 days after a period.
If you're experiencing bleeding 10 days after your period has ended, there can be several potential causes. One common cause is ovulation bleeding, which occurs when the egg is released from the ovary. This can lead to light spotting or bleeding mid-cycle. Ovulation bleeding is usually harmless and doesn't require medical intervention.
When to be concerned.
While bleeding 10 days after a period can be normal in some cases, there are situations where it may indicate an underlying issue. If the bleeding is heavy, prolonged, or accompanied by severe pain, it's important to seek medical attention. These symptoms could be signs of conditions such as hormonal imbalances, polycystic ovary syndrome, PCOS, uterine fibroids, or infections. It's always better to consult a healthcare professional who can evaluate your specific situation and provide appropriate guidance.
Keeping track and seeking medical advice.
To monitor your menstrual cycle and any changes, it can be helpful to keep a record of your periods. Tracking the duration, intensity, and any additional symptoms can assist in identifying patterns and potential abnormalities. If you notice consistent or concerning changes in your menstrual cycle, it's advisable to schedule an appointment with a healthcare provider who can conduct a thorough examination and provide a proper diagnosis. In conclusion, bleeding 10 days after a period can have various causes. While it can be a normal variation in some cases, it's important to be vigilant and seek medical advice if the bleeding is heavy, prolonged, or accompanied by severe pain. Remember, each person's menstrual cycle is unique, and what's normal for one may not be the same for another. Taking note of changes, tracking your cycle, and consulting with a healthcare professional are vital steps in ensuring your reproductive health. Take care and stay informed.